Welcome, welcome everybody. We really appreciate that all of you are here and that you're logging in. Today we have a very special webinar prepared for you. Dr. McDougall is interviewing a doctor that we all know and love, and it's going to be another great webinar. And I'm just going to pass it on to the master here, Dr. McDougall, and we will go from there. How are you doing, Dr. McDougall?
Oh, I'm doing fine. I'm looking forward to the interview, and I'm going to be tough. Even though this is my friend coming up here, and been my friend for 35 years, I'm going to be a tough guy when it comes to interviewing him and asking him some questions. But just to get started, I want you to know how things have been going for me really quite well. As a matter of fact, Mary and I just got back from the 10-day live-in program in Santa Rosa, California, which we go down to, and we spend a few days lecturing and getting to know the people and having a lot of fun. Dr. Anthony Lynn, of course, is their primary physician down there. But hey, once in a while, the old man has something to tell Dr. Lim about taking care of patients. So I do perform some function. Anyway, we just got back last night and had a great time at the 10-day program. We'll see all of you in March at the 3-day program in Santa Rosa, California. Sign up now. And the other thing I want to tell you, which I never talked to you about, is I was just having breakfast this morning. It's maybe, you may not think so, but it is true. Every morning Mary and I have this for breakfast. Okay, this is oatmeal. This is a Stay Full oatmeal by Dr. McDougall's Right Foods. And I just am in the process of finishing that off. But these are great meals. They're in over 6,000 stores nationwide. And you'll find soups and cereals and all kinds of things that you can eat. I encourage you to make them entire meals if you'd like at times, but mostly as side dishes. Take a couple baked potatoes and throw a chicken ramen over the top, or a tortilla soup over the top, or something from Dr. McDougall's Right Foods. But this has been my breakfast. Sorry I didn't cook this morning, but it was not planned. It's just there. Let's get on.
Who knew you could cook, Dr. McDougall? We didn't know that you could actually
make cook. Sure, I cooked this. I cooked it. I would like to show you how I cooked it from my hot water dispenser. It took me, like less than 7 seconds. It's easy. Anyway, Dr. McDougall's Right Foods, they're in all your grocery stores, all of your health food stores, or you can get them on Amazon. But anyway, I just wanted to tell you that I'm alive and well and active, and this is one of the reasons I eat well, and I'm exercising and just having a lot of fun in life. So I'm back. And part of the honor of being back is I get to be back with my friends who have helped me change the world. And it's changing. Oh my goodness, changing. We talked about recently how the Canadian guidelines, dietary guidelines, excluded the poisonous milk secretion industry. Yeah, bodily secretions of a cow. They essentially banned them from the Canadian guidelines. Dietary guidelines, and the dairy industry is upset, and so is the meat industry, and that happened in the first week of January 2019. And then I talked to you about a mid-January 2019 landmark paper from the Lancet Commission called EAT, E-A-T. Look it up on Google, EAT, Lancet Commission. And what they say is if we're going to save this world, this planet Earth, we must change our diet radically. And you know what they recommend? McDougall diet. Yeah, I've only been telling this for 45 years. And now, the world has caught up. Way too late. Now, all of us work together and get this place changed. But they tell you that in the commission report that you should only have red meat once a week. Admittedly, that does fit in with the McDougall program if you want. Doesn't have to be what I choose. All right. Anyway, the world is a great place, and my friends and I are going to do everything we can to keep it going in the right direction. So, Dr. Esselstyn, S as I will call you, because I call my friends by their first name. I call my mentors, like Nathan Pritikin, Dennis Burfitt, etc., Walter Kepner, I always call them Dr. So-and-so. But I had the honor and privilege of knowing you for 35 years. And you have been at Cleveland Clinic, an extremely important person, a general surgeon and the head of the Breast Cancer Commission at Cleveland Clinic. And just to give a little bit of history before I let you take over the show, and I know you'll have no trouble at all entertaining us for the next 45 or so minutes, is that you come from a family that's very prominent at Cleveland Clinic. Your father-in-law was Barney George Cryle, and he was a very famous breast cancer surgeon. In fact, he gave me the confidence 40 years ago to do only lumpectomies on women and to ban mastectomies from my practice. That was your father-in-law, George Barney Cryle, and that's where we met, you and I, with your father-in-law one afternoon after I did a television show in Cleveland. And his father is the one that established Cleveland Clinic. Do I have the story right so far, Dr.?
You absolutely do. I think it's kind of fun to hear a little bit of the history of how Ann's father, Dr. George Cryle Jr., got interested in less than mastectomy, or less than radical mastectomy, because he made good friends of these two. I guess it was from a town in Illinois, where during the war, all the surgeons had gone overseas. And suddenly the women at home, when they had breast cancer, these general practitioners did not feel competent doing the radical mastectomy. So they did a simple mastectomy for these patients who had the breast cancer. And sure enough, when Barney found out about them, they wrote it up, they found out that the results of these general practitioners who were doing the simple mastectomy were just as good as the radical mastectomy results were. And so this was one of the great stories that got him inspired.
I don't want to be too personal. In fact, you can tell me if I'm incorrect, but as I remember it, Barney Cryle had two wives.
Correct.
Who, separately, of course, who had breast cancer themselves.
Correct.
And he was kind enough, I believe, to treat them in a humane manner.
That's right.
And I fought for this. I got the third law on informed consent passed in Hawaii back in 1982. And again, it was because of your father-in-law that I was inspired to move forward. And for a while there, back in the 1970s and 80s, early 1970s and 80s, they reduced the numbers of radical mastectomies, but unfortunately, they're back on the way up. You see that at Cleveland Clinic, that it's becoming more and more popular to mutilate a woman with a radical mastectomy unnecessarily these days, as opposed to in the 80s and 70s.
No, I think that still the idea and the concept of, we just had a very close friend, as a matter of fact, last week, who had a partial mastectomy, and at the Cleveland Clinic. So that really is, it's still in vogue in appropriate situations. Yes.
Well, of course, I would say the majority of breast cancer surgeries are still lumpectomies and always the addition of radiation. But the trend on mastectomies is heading from its low point back in the 80s and 90s, heading back up. And of course, this is a much more radical operation, much more money generated, and it's based on false beliefs that are clearly known by any scientist, that radical mastectomy is just a mutilating procedure with no survival benefit at all. All right, but that was the introduction. Now let's get to Dr. Caldwell Esselstyn, my friend S. We met about 30 years ago. Ann, his lovely wife, and Dr. Esselstyn, and my wife Mary, and I met in Cleveland. We were there doing a show to sell books. I'm a book salesman. As you well know, that's how I supported my family for many years, is going around the country selling books. Well, we were in Cleveland, and probably our second time. First time was when we met with S and his father-in-law. I had met with them. And the second time, the four of us got together and we discussed the importance of a good diet 30 years ago. And I just, I have the feeling, many other things, of course, laid the foundation for Dr. Caldwell Esselstyn to be one of the world experts on diet and to be given the Lifestyle Achievement Award by the American College of Lifestyle Medicine because of his phenomenal work. But Mary and I had a little bit of influence. And
John, listen, you were really right there. The whole thing got started when I was so disenchanted in the late 1970s, early 80s with the fact that, for no matter how many women I was doing breast cancer surgery, I was doing absolutely nothing for the next unsuspecting victim. And that's what led me to some of this bit of global research. And it was quite striking to see that in places like Kenya, breast cancer rates were 30 and 40 times less frequent than in the United States. And if you looked at rural Japan in the 1950s, breast cancer was very infrequently identified. And yet, as soon as the Japanese women would migrate to the United States by the second and third generation, they now had the same rate of breast cancer as their Caucasian counterpart. And perhaps even more powerful was the cancer of the prostate. In 1958, in the entire nation of Japan, how many autopsy-proven deaths were there from cancer of the prostate? 18, the most mind-boggling public health figure I've ever known. So along about this time in this review, it became apparent to me that there would be more bang for the buck to look at the leading killer of women and men in Western civilization, which was coronary artery disease, because here were these multiple cultures where cardiovascular disease was virtually non-existent. And so the dream of mine became, if we could only think about getting people to eat to save their heart, then would they markedly diminish the likelihood of getting the common Western cancers of breast, prostate, colon, and maybe even pancreatic. And along the way, though, I ran into this amazing book called the McDougall Plan.
oh,
And that really triggered me. It said, I've just got to do this study. There's just too much evidence from my global review, from reading the McDougall Plan. I have to do this study.
yeah, well, you wrote a paper, I believe it was in the journal Thorax, correct me if I'm wrong, about how heart surgery was the new radical mastectomy.
Oh, no, John, that was in the American College of the American Journal of Cardiology. Bill Roberts.
Yeah, okay.
Bill Roberts. And the title of the article was, "Is the present therapy for coronary artery disease the radical mastectomy of the 21st century?"
There you go.
Because my concern was this. Over the last 40 years, John, we've had drugs, we've had stents, we've had bypasses. 40 years ago, cardiovascular disease was a leading killer of women and men in Western civilization. With all these new drugs, with all these new operations and stents, coronary artery disease is still the leading killer of women and men in Western civilization. So that's why, I said we really haven't made much progress. Why? Because we have not been treating the causation of illness. And ever since the days of Hippocrates, there's been a basic covenant of trust that whenever possible, the caregiver will share with the patient what is the causation of the illness. And sadly today in cardiovascular medicine, that simply is not being done. And the exciting thing for me was that 4 years ago, I was invited to be a member of the American College of Cardiology because they wanted me to join their nutrition committee. And one of the things that we really have on top of the list is trying to educate the cardiovascular community about the causation of the illness that they have been designated to treat.
Okay, but that original paper comparing mastectomy to open heart surgery was the first step in helping people take the next step. I believe, and I've always taught, and I've been criticized for it, you have to put people in a position where they can stop relying upon standard medicine. They have to understand the actual harms and limited benefits of diabetic treatment, heart disease treatment, breast cancer treatment, etc. You have to understand that the medical business is going to fail you before you're able to open your eyes and look for alternatives like you started teaching 30 years ago along with your beautiful wife, Ann, to help hundreds of patients with the coronary artery disease. But first you had to get them out of the hands of the heart surgeons because they are very convincing, to say the least. So anyway, do you remember your the first program you and Ann decided to run back in Cleveland? It must have been 20, 30 years ago.
April of 1934. April of 1984. How's that?
Oh, I like that.
Yeah.
Yeah, you were probably, that's close enough. You're only 50 years off. What's 50 years, right, at our age? Yes.
I know, John.
How old are you now?
85.
85. Amazing. People come up to me all the time and say, why don't you look as good as Dr. Esselstyn? How old you are. So I try. But,
Yeah.
maybe can you send me your brand of makeup? Whatever it is, I need it.
It's on the way, John.
You look so good, 85, and you're so functional. I remember when we went to Costa Rica together, you had 17 members of your family along with us when you went on one of our Costa Rica adventure trips. And I remember in the Houston airport, I was riding the conveyor belt, and you were sort of right next to me, walking along, passing me. And I'm on the belt, and you're walking. And I tell you, you are an amazing physical specimen, not to mention your mental acuity, which is drawing the attention of doctors all over the world. And you speak to doctors all over the world, all over the country, and they like you a lot, as I do, because of your manner. You are a professional, and you are able to talk to people in a way that they're willing to listen, not only patients, but other doctors. So anyway, getting back to the 1984 onset of the Esselstyn program to reverse heart disease. You ran it the first time. You did it in your home, correct?
Yeah, we had patients come out to the house, and we had to see. I was so petrified that the study would collapse with the lack of patient compliance, and so what I did with this small group of 24 patients, I began to see them every 2 weeks. The reason was that I had learned from a West Coast surgeon by the name of Bert Dunphy years ago, and he said that patients with cancer are not afraid to suffer. Patients with cancer are not afraid to die, but patients with cancer are afraid of being abandoned by their family or by their physician. And so I used that same mantra for my patients with cancer, and I also employed it for these patients with cardiovascular disease, because that's why most cardiologists will see their patients twice a year. I was seeing these patients every 2 weeks for the first 5 years, went over every morsel they ate and drew their cholesterol. And after 5 years, I got courageous and I stretched it out to once a month. And after 10 years, John, they were almost on autopilot. And so I began seeing them quarterly. And then at 12 years, that's when we wrote up the study, which I think made it then and even perhaps now one of the longest studies of its type. For heaven's sakes, 12 years is almost half a career.
Right. Well, can you tell us what your first study showed? I know it's caused a large number of people to have their eyes opened, but it's also caused a bit of controversy.
Oh, yeah.
But
No question.
you showed, tell us what you showed.
Well, what was exciting about it was the patients that I received, they were, as my late brother-in-law used to say, they were Essie's walking dead. They had failed their first or second bypass. They had failed their first or second angioplasty. They were too sick for these procedures, or they had refused. And there were 5 who were told by their expert cardiologists they wouldn't live out the year. Well, those 5 made it beyond 20 years. And we began to suddenly see in measurement of these people, they were losing weight, their symptoms were disappearing. And then we began to study them and found out that there were a significant number that were actually reversing their disease.
Well, that's pretty amazing. And as a result, you have been known as the leading cardiologist of the Eastern United States. There is another doctor who claims that he is the leading cardiologist of the world in the West, but we won't mention his name. He's one of our guests on our show. You are so well known and respected based on not just that study, but you also studied 200 additional people and published those results in what? The American Journal of Family Practice. Do I have that one right?
You got it right. Well, we got hammered, John. I got hammered after our first study because it was even then it was very threatening to a lot of people, and so it was criticized for not being randomized. It was not large, and yet the criticism was, how do you know with that diet, which is such an extreme, severe, strict diet, that you're ever going to be able to repeat something like this and get similar results. So we went ahead, and that's when we studied we published this one on some 200 patients, and lo and behold, what happened? we got even better results. Yeah.
And you published that, and that
Yes.
caused a lot of well-deserved attention. I mean, you just have to get people to see that there's another possibility, just to open their eyes. And so you and Ann took people to your home, had meetings outside of the home, took care of these people. What did you teach them? I'm sure you taught them a little exercise, a little sunshine, not smoke, not drink too much, etc. But food-wise, what is the Esselstyn approach to good nutrition?
Whole food, plant-based nutrition without oil. And by that, really, you mean what you're going to eat. You're going to eat all these marvelous whole grains for your cereal, bread, pasta, rolls, and bagels, 101 different types of legumes, lentils, and beans, all these marvelous red, yellow, and green leafy vegetables, and some sweet potatoes and white potatoes, and some fruit. And now through your books, Neil Barnard's books, our own books, Ann and Jane, my daughter, and my wife's book, there are now, many authors who have really tackled this in a wonderful way that gives the many safe varieties. Because what we are asking people to do is this: we want to take away the food that to them looks good, smells good, and tastes good, but is destroying them. And in place of it, we want to give them a food that looks good, smells good, tastes good, and absolutely glorifies and enhances their health.
All right. And you see this, of course, what impresses my colleagues, our colleagues, and impresses me too, is you actually see this on angiograms. You see the reversal of the underlying disease by special x-rays that are done. And so there's no doubt. I mean, it's just, how can you contest evidence such as side-by-side x-rays showing reversal of artery disease? But that's not really the important thing. That's a secondary issue. The important thing is that people live better, more functional, feel better, and live longer, a better life. Do you see that, or are they just specimens that have good x-rays?
No, that's the fun of it. Why am I now almost 19 years after retiring from surgery? I am so much more passionate about medicine than ever before, because we have never before had in our toolbox a tool that was so absolutely incredibly pervasive, with the possibility of literally annihilating 80% of chronic illness. And it's just, to me, so exciting. By the way, there are 8 ways we measure disease reversal. You mentioned the angiogram, which is kind of sexy when that works. There's this reverse distress test. You can reverse the PET scan. You can reverse the pulse volume showing in the legs. You can reverse the carotid ultrasound showing reversal of disease in the vessels going to the brain. And then, of course, you can reverse the symptoms of claudication, angina, and erectile dysfunction. 8 ways to measure disease reversal.
Wow. And it costs nothing. Cuts your food bill by 60%.
Yeah.
And it's free on Dr. Esselstyn's website and Dr. McDougall's website and a few other websites. The information is absolutely, totally free. Or you can really get extravagant. You can go to a used bookstore and you can buy the book, Something to Reverse Heart Disease. Excuse me. Prevent and Reverse Heart Disease by Dr. Esselstyn. The brain is going. For 25 cents in a used bookstore, you could buy Dr. Esselstyn's.
Or you can try RIP's 7-day rescue.
Okay, do they have that in the used bookstore yet, or is it still for sale on Amazon? Your book is probably still for sale on Amazon, isn't it?
Yeah.
Okay. All right. Now I'm going to get tough. Dr. Caldwell Esselstyn, in other words, known as S by me. I'm going to get tough because I've known you for a long time, and I want to have some comment. I mean, you have had an exciting life, a marathon athlete who I believe was rowing events. You won in the Olympics. You have had a fabulous career as a general doctor, a general surgeon. I mean, you've been a really well-known, well-experienced person who has had a very interesting and I know an enjoyable life, particularly living with Ann. And it's been it's been great to say the least. But you have had your detractors along the way. And let me just mention a couple of names.
Sure.
Mike Roizen, who is at Cleveland Clinic and has been the head of one of their health divisions, nutrition divisions. And I believe he had something to do with getting McDonald's out of Cleveland Clinic.
Yeah.
But for a while there, he didn't like you. And he came to our program, you remember, and I sent you a video of my interview with him. He had a tough day, but he had an enjoyable day being at our program. But I'm going to tell you, there was 20 minutes he spent on stage with me asking him questions that I think you and Ann sat and laughed for 20 solid minutes. But now he's your friend, Mike Roizen. Big deal. Well published, well known. What do you think about that guy? Or don't you want to say anything? I don't blame you if you don't want to say anything.
No, actually, Mike has done some wonderful things to the clinic when he's gotten rid of all the fryers. He's gotten a lot of those candy dispensing machines, and really made right now we're in the process of working with Mike to make more and more plant-based meals available to patients at the clinic, and it's really kind of exciting to see those food changes. Now, Mike and I, it's like so many people who are in this activity, yourself and Dean and myself, Neil, and really a number of others that are so much a part of this. If you really dissect out, there'll be these little differences between us, and crazy people try to emphasize these differences, whereas I always have fun saying, let's do this. Why don't we talk about the 98 or 99% of the time when we're actually on the same page? Because I think that's where the stronger message would be. But Mike Roizen has been a great help to me, and I actually made him a co-author on that paper of those 200 patients. And to his credit, when I asked him to do this, he said, I want to know what your material is. And so I took out all the spreadsheets, and we took about 3 days, and we went over every single one of those 200 patients again with Mike before he would agree to put his name on it. And it was really, to me, very important to see the integrity which he had. Now he does eat a little bit more fish than I ever would recommend, but really that's about the only fine point from the nutrition standpoint.
Well, Mike Roizen is an example of how we have made friends along the way, and that's why I bring him up as an example, because he started out very skeptical of your work, and now he has been very much in favor of it. Same thing when he came to our advanced study weekend in Santa Rosa, California. He walked in after a long flight from Chicago, not happy at all. And then he gave his presentation, and I caught him on a little bit of a problem. And he showed the Mad Cowboy show that was on Dr. Oz's show. They remember about the cowboy that lost the 60 pounds and so on your son's diet, Rip Esselstyn. And he talked about that and how wonderful that was, and showed a video during the presentation at our advanced study week. Then he turned around on the next slide and started promoting a high protein, low carb diet. And I said, Dr. Roizen, I said, I'm confused. And the next 20 minutes, for the first 10, I'm sure he wished he wasn't there. During the next 10, he and I developed a friendship. And when he left the program a couple hours later, I made him a veggie burger and a plate of baked beans. And I said, take this along on your trip home. You'll love it. And he has become a friend. But that was Mike Roizen. Now I'm going to mention another name. You say that all you have to do is provide the data and then everybody will jump on board with the truth. How about Neeson? Do I have the last name right? Tell me his first name. Will you not comment?
Steve is the chairman of the Department of Cardiology. And I think that, he's really been very focused on what they do down at the mainstream, at the main campus. And there they treat people with drugs, and they treat people with when necessary, they'll have stents and they'll have bypasses, but I don't think Steve really has yet bought in entirely to the benefits of plant-based nutrition. And I think that I've never had I've never had a harsh word with Steve that I'm aware of, but it's still apparent that he's still a ways away from joining on. I think that the thing that is interesting to me is there are close to now 39 people on the American College of Cardiology Nutrition Committee. And I think all of them except one is totally committed to plant-based. And I'm sure that eventually that when more and more of the science comes out, that Steve Nissen, who is such a strong believer in science, and I respect that, he will find that as this science comes around, he, I'm sure, will be a great advocate for plant-based nutrition. But
okay, folks, now you understand why Dr. Esselstyn is such a better communicator than I am. He is so politically correct, so kind. Steve Nissen has actively and aggressively done everything he can to discredit you in the medical press. That's my interpretation. So you haven't convinced.
John, but part of the fun about what I do are the challenges, and the people that disagree with us are the challenges. But one thing that I've learned is that if you look at the work of a recent physicist who won the Nobel Prize, he said something very interesting. He said, the scientific method is really quite straightforward. If you look at the scientific method, you propose a theory, number one. Number two, you do the experiment. And the experiment is either right or it's wrong. The scientific method is really quite straightforward and quite simple. And a recent physicist who received a Nobel Prize said the following: with the scientific method, one, you propose a theory. Two, you do the experiment. And the experiment is either right or it's wrong. It doesn't depend upon the amount of money belonging to the investigator, doesn't depend upon previous bias. It's either right or it's wrong. So if we say, I wonder if we were able to take these patients with coronary artery disease and give them the same diet, essentially, that we see in the planet Earth, where there is virtually no coronary artery disease, maybe we could reverse it or possibly stop it. And it happens once, and it happens twice, and it happens thrice, and it happens again and again and again. And now it's still not randomized and not prospective, but it does follow the scientific method. And it's very fascinating, John. If you look at the history of medicine, when Jonathan Snow in the 1830s, he decided that he would take the handle off the Broad Street pump, and because there was this cholera epidemic, and he recognized that the sewage in the Thames was going into this, apparently the water supply of these people in Broad Street. No randomized study, took the handle off the pump, stopped the epidemic. Next along thing comes what? The invention of ether in 1849, Thornton. And gosh, here's this wonderful gas you can operate on people without hurting them. Where was the prospective randomized study? Lo and behold, along comes Semmelweis and Lister and Pasteur. Where was the randomization? Then comes Landsteiner and their blood groups. Where was the randomization? Then these crazy guys up in Canada, Banning and Best, this stuff called insulin. Where was the randomized study? Along came Alexander Fleming and Florey. Where was the randomized study? Along came these wonderful guys from Australia who said, that duodenal ulcer gastric specimen you gave us has these bacteria in it. What? Said the surgeons. I mean, this was my most common operation when I first went into surgery, operating for duodenal ulcer. These guys from Australia said, no, we think it's these bacteria that are causing that ulcer. You guys from Australia are down under. You must be crazy. They weren't. They were absolutely right. Duodenal ulcer was wiped out. They got the Nobel Prize later on for that wonderful discovery. Where was the randomization, John?
Yeah, well, that's that goes all the way to the the present stand we have worldwide on tobacco. This is all based on observational studies. There's no randomized controlled trials with cigarette smoking and whether or not it causes lung cancer. Observational studies. I was told at one time when I wanted to present our data on treating Blue Cross Blue Shield of Minnesota patients with my program, I wanted to publish the data, and one of the journals I went to said, we don't publish any N1 studies, mean observational studies. We only publish double-blind randomized controlled trials. Well, you can only double-blind randomize drugs. You can't do it with food because people can see the food. So you can't double-blind any kind of study that we do. It all has to be single-blinded or observational. But, that's what the journals say. They can get in bed with the drug companies just by making a rule that we don't accept anything as being real science unless it's randomized, double-blinded, controlled trial. That means only drugs can you test and a few surgeries. All right, let's get into some other controversy. Whenever your name comes up, particularly in reference to what Dr. Bernard and Dr. Clapper, Dr. McDougall, Dr. whatever, all of our friends, Dr. Campbell, etc. Whenever the discussion comes up, and as you said, 99% of what we try and teach people is exactly the same. You are well known, Dr. Esselstyn, as the guy who forbids nuts and avocados. And people say, they're not good for you. They actually prevent heart disease. And, go ahead. Tell us about nuts and why you take that stand.
Well, what I learned early on was that a saturated fat was a culprit in the coronary artery disease. And I didn't like the idea that when I studied nuts, there's a great deal of saturated fat in nuts. And this didn't seem to be a wise thing because I asked myself, how many times have I ever seen a patient who would eat one nut? Nuts are highly addicting. And if I ever go on record as saying nuts are okay, they're going to be in the glove compartment, they'll be in the bathroom, the kitchen, the dining room, the hallway, the workbench. And that's just not what I want for my patient with heart disease. Now, there are two things that I think are very important to say. On page 69 in my book, I have a passage that I say that I do not object to patients who do not have documented cardiovascular disease having nuts. However, once the diagnosis of cardiovascular disease is established, I do not like my patients to have nuts and avocado and additional fat because I have yet to see a single study in the medical literature where someone has taken patients who were seriously ill with cardiovascular disease and had them have peanut butter, nuts, and cashew sauce and have their disease halt and reverse. I haven't seen that study. And when I think about it, if I have proven wrong and my patients all should have had nuts, I have not done them a disservice. I've not hurt them. On the other hand, if we find out eventually when that study is done that if you take patients seriously ill with heart disease, remember, they're there because they have so seriously trashed, injured, and compromised the capacity of their endothelial cells to make nitric oxide. They don't have enough. Well, I don't want to do anything that's going to further compromise and injure the endothelial cells further. And so that's one of the reasons that I'm very adamant, as I guess I'm an outlier on nuts, but being an outlier or not, I will take our results and match them with anybody else on the planet. And for that, we don't apologize. So now the other thing that has crept into the whole literature here about nuts is that when you look at many of these studies for nuts that have been printed in peer-reviewed journals, suddenly there's this awkwardness where the study has been funded by the nut companies. And that immediately sort of casts a certain darkness over the authenticity of the study. And I would remind anybody who's interested to be in touch with Jeff Nelson, who recently has done part 1 and part 2, where he has carefully analyzed these nut studies, and they are egregiously flawed. And there are certain investigators, I will not name them today, but Jeff Nelson has named them, and there are 3 in this country and 1 overseas who are notorious for taking money from the nut companies and then arranging a study that will favor the output of nuts. And there's a wonderful summary in his presentation by Cochrane. And they are very clear that they said there is no science to indicate that nuts have any superiority in protection from cardiovascular disease.
Yeah. Well, you know, just to clarify, those of you who are not totally familiar with my recommendations, is I recommend a diet of starches, vegetables, and fruits, and nuts and seeds and avocados are for special occasions and in healthy people. So our recommendations are essentially the same. But see, I don't have that stuck to me, the mantra that nuts are bad. And you do. So that's it. You're going to have to live with that. But there are many people. But I would like to make one comment before I ask you to go on, and that is that one of the nut-based diets out there that is the most popular, particularly among medical professionals, is the Mediterranean diet. The Mediterranean diet. This basic study, the PeriMed study that was done on the Mediterranean diet was sponsored by 2 olive oil companies and 2 nut companies. In other words, it's a study to sell nuts and olive oil. And that's all the Mediterranean study is about.
And that same study had to issue a retraction in the New England Journal of Medicine. It's interesting. To me, what was fascinating about the PeriMed study is this. I remember I was presenting at the Brigham at Harvard a year ago this month, and after I was finished and I had said my bit about nuts, one of the well-known cardiologists in the front row said, "Well, what about the PeriMed study?" I said, "Well, here's my take on that. They took patients from Spain, and there were 5,000. And one of the requirements to join the study was they could not have had a diagnosis of cardiovascular disease. Then they were put on these 3 different diets. One was the Mediterranean diet with nuts, the other the Mediterranean diet with oil, and the other was the so-called low-fat diet at 39 and 37% fat. Well, and at the end of 5 years, what happened? Every single group had scores of patients who had major cardiac events, heart attack, stroke, and death. And so I said, I don't see how the title of that study should have been the prevention of cardiovascular disease with the Mediterranean diet. I said, I think they have the wording wrong. It had to have been the creation of cardiovascular disease with the Mediterranean diet.
Yeah, well, this is just another example of the widespread lies that are going on that not only the lay people but the medical profession buys into as the Mediterranean diet. It's just a business is what it is, sponsored by the olive oil and the nut industries as well as other industries. And this has nothing to do with good health. I mean, what's the Mediterranean diet? The diet that's eaten in Turkey or Spain or Greece or, the Mediterranean area is huge. It involves many types of diets. But I guess there's one thing we can say about the Mediterranean diet is the people that they studied ate more vegetables, more fruits than the average person living in the United States. So there were some benefits in spite of the nuts and olive oil, not because of them. In fact, there are studies that show that olive oil promotes atherosclerosis in experimental animals and some evidence in people that olive oil is atherosclerosis promoting. And those studies are in a book I wrote called, several of them, The Starch Solution, the McDougall Program for Heart Disease, and probably in the book Prevent and Reverse Heart Disease by Dr. Esselstyn. you'll probably find the same type of research cited. So here we sit, you and I both working. We should be retired. We're not. We have a huge surrounding of talented people who are helping us. Your son, your daughter, the Engine 2 program, which is very famous worldwide, done by your son, Rip Esselstyn, and Jane is doing a phenomenal job of writing cookbooks and teaching. And you're kind of like the rest of us in this movement, which includes Dr. Greger, Dr. Ornish, Dr. Furman, et cetera, et cetera, et cetera. All of us on the same side of the road. We can't stop thinking about this. This is the problem. Once you have your eyes open, that's all you can think about, particularly if you're a doctor, is it causes disease. You know how to cure 80% of the problems that people have, which are the chronic diseases. And as a result, you're like me, Dr. Esselstyn. You can't think of anything else. You get up in the morning and you start thinking about it. You go to bed at night and you're still thinking about it. I know you are, because I am. It's a difficult life to only be thinking about the liars, cheaters, and polluters and how you're going to stop them. So how are things going business-wise for you? And I don't mean that in the money sense, but in the sense of changing the world. Are you getting more and more attention or less and less? Where is the world going in your life based on your experience?
To me, I think when you can look back to when I first met you and even prior to that, my gosh, if anybody was eating plant-based, you were really pretty far out in left field. I know it was an enormous change for me because I grew up on a Aberdeen Angus beef farm and a dairy farm, and God, I was a cholesterolholic. And it took me close to a year living with this idea that as I read and read and read more and became more familiar with what was going on, and especially as I told you when I read the McDougall plan, I just said, I just got to do this study. There's no other way around it. But before I did the study, I had to have a commitment to do it myself. And that took a little while, but I can still remember going through those three phases that Prochaska has so well defined when you're going to make a lifestyle change of pre-contemplation, contemplation, action, and maintenance. And I can remember thinking about this, and it was April of 1984, and Ann and I were at a surgical meeting in New Haven, Connecticut, and gosh, the papers were really not very exciting, and the weather was rotten. But they always have a banquet after these surgical meetings, and at the banquet, the waitress put this plate in front of me with roast beef. It was so huge it was draped over the sides, and I shook my head, and Ann looked at me and said, "You're not going to eat that?" And I said, "Nope, this is my epiphany." She said, "Well, then I'll have it."
Oh man.
Well, then actually, you should know that Ann's mother at age 52 had died of cancer of the breast. And at 2 weeks after that meeting in New Haven, her sister came down with cancer of the breast. And she looked at me and she said, "I'm with you." And so that was when we had our epiphany. In April of 84, we became plant-based, and I haven't had a piece of meat since, knowingly a piece of meat since that time. So it was pretty exciting to see that change. And the reason I'm so delighted and pleased is that I never would have dreamt that at this phase in my life, that as retired as I am from surgery, that I would have so much passion about the field of medicine and such a absolutely overwhelming sense of reward when you take somebody who is a patient with heart disease. You save them from having an operation such as stent, or you save them from having bypass surgery, and they suddenly find out that 2 or 3 days or 2 or 3 weeks after they started the program, their angina has begun to disappear. John, it doesn't get any better than that.
The greatest reward in life is helping other people. And I know you know that as well as I do. And people can come to Cleveland and spend time with you and Ann. still, and they can go see your son in Austin, Texas, in the Engine 2 program, and he runs programs all over the country. Rip Esselstyn does. So the Esselstyn family is there to help and fully active. And the website that you now would send people to is which, Dr. Esselstyn? What website would they best find out what your schedule is?
Dresselstyn.com.
Okay, so that's easy enough. ESSELSTYN, dresselstyn.com. And there's no period there. It's DR, correct? DR Esselstyn.
That's right.
Okay. So
Yes.
you go to his website and you'll see, and you'll be shocked at his traveling schedule. I mean, it scares me when I look at it. But, you know, you're a well-loved man, particularly among the real doctors. And for quite honestly, I have not gotten the acceptance that you have in the established medical business. And I think it's because of your persona, your intelligence, your ability to handle the facts, the knowledge, your dedication, is that you've been well accepted. You have made a major contribution to saving planet Earth and so many people's lives. So I want to thank you very much. Any thoughts you want to share as we depart this wonderful conversation?
John, well, first of all, yes. John, let me say what a treasure it's been to have you take this time and make this a recording with somebody that I've always looked at, admired, and championed. And it's been such a privilege for me to know you and know your works and actually know how wonderful and lucky you are to have somebody as supportive as Mary. My closing comment would be really pretty straightforward. And the reason I think that I'm so exhilarated is that right before us, we see now more than ever before the seismic revolution that can occur in health. And the seismic revolution that we see before us is never going to come about through the invention of another drug, a pill, or another procedure like a stent, or another operation like a bypass. The seismic revolution will come about when we in the profession have the absolute will, the grit, and the determination to share with the public what is the lifestyle, and most specifically, what is the nutritional literacy that we can empower them to know about so that they themselves can be the locus of control to absolutely annihilate chronic illness. John McDougall, thank you so much.
Well, thank you, Dr. Caldwell Esselstyn, author of Prevent and Reverse Heart Disease and the Esselstyn Program, which is well recognized worldwide. You can get a hold of him at his website at dresselstyn.com. You can find out his speaking schedule. Likely he'll be in your hometown sometime this year because he's a man that loves to travel still. And certainly if he doesn't come to you and your doctors and your hospitals, and he gets invited, you can always come to see Dr. Esselstyn personally or to see members of his family and help change your life. This kind of input from the Esselstyns is crucial. And all I can say is thank you for being my friend for the last 35 years, and thank you for, being in the same army, marching to the same drummer to try and save this planet and save the people from an out of control medical business and food business. It's just so sad. And you and I, we've lived our lives. Yes, you're 85, I'm 72. We can look back and say, let's face the facts. We have children. You have many grandchildren who I've met. I have 7 grandchildren. We have a purpose. You and I, the old guys, have a purpose to get out there and give the younger generation a chance. And the only way that we're going to save this place is by changing the food. I want to thank you very much. And of course, I want to thank Dr. Gustavo Tolosa, who has coordinated this webinar and added so much to my life in a positive way. It has been a pleasure. We'll be back with you doing our webinars every 2 weeks. I'm Dr. John McDougall. I am still very active in the McDougall program in Santa Rosa, California. We try and make every event, including the 10 days and the weekends, and we're running a 10-day right now. And we'll be running ones for Whole Foods and CenturyLink and the general public. And we'll be running a 3-day program in March of 2019, which you can find on the website. So I'd like you to come and see Mary and I, please. And maybe we can get Dr. Esselstyn and Ann to come out again. They've probably been out 6 times to be primary speakers at our meetings.
I really want to thank you, gentlemen, because your passion and your determination is contagious, and it should inspire all of us here to go out there and really, be an army to save this wonderful world and our families and our friends and our children and grandchildren. Thank you so much.
It's the food.
Thank you,
And
Gustav.
our time is well worth it. Thank you for your great contributions, both of you gentlemen. I'm Dr. John McDougall, and look forward to seeing you in our bi-monthly webinars. And they're posted on the website, drmcdougall.com. Turn your friends and relatives on. All you got to do, you don't have to convince them. All you got to do is get them to open their eyes. And if this interview with Dr. Esselstyn hasn't given them an opportunity to open their eyes, then you're just going to have to wait and try again. Because we've done our best. We've done our best. And it takes time. As Dr. Esselstyn said, it took him a year. It took Mary and I 2 years after our eyes were open. But that was in the early days. Now you ought to be able to do it overnight, because the whole world has changed and is supportive of a low-fat vegan diet, which is a plant-based diet, which is a starch-based diet, which is the diet that people on our side of the fence recommend, as opposed to those on the other side of the fence who are killing the world and the animals with their low-carb diets. I'm Dr. John McDougall. Thank you for joining in. See you next time.
Bye, John.